All right, so I'm just going to jump right in. Can you explain the connection between Lyme disease and psychiatric symptoms? What's happening in the body and brain that leads to these symptoms?
Sure, I'll do my best. So with infections like Lyme disease and frankly other infections that you can get in a tick, they can cause a lot of neuropsychiatric symptoms. So I predominantly see people who are presenting with neurological symptoms from these infections and also psychiatric symptoms. And it's usually a combination of the two, which would be what we would call neuropsychiatric. And my best guess is that we're seeing psychiatric symptoms because the infection is in the brain. But there's probably a lot of different kind of ways that infections can give people psychiatric symptoms. So it could be physically changing the anatomy of your brain. The infection can be in your brain. We know that anytime someone has an ongoing infection, we see increased inflammation. So oftentimes, for example, if someone is sick and we start antibiotics, we can see symptoms worsening in the first few days of the antibiotic treatment. And that's probably related to increased inflammation. So there's a lot of, you probably heard about cytokine storm with people who had COVID. So same kind of thing happens with Lyme disease. Or for example, if someone has Lyme disease and we start treating it, you see increase in cytokines, which are just basically proteins that the immune system makes, like molecules of communication within the immune system. But anytime you have increased inflammation, you can see cytokines, like a significant increase in cytokines. And it just kind of depends from an infection standpoint. Sometimes I can see people who come in with the same infection having only neurological symptoms. Other people with the same infection can only have psychiatric symptoms. So these infections have a tropism for the brain, so that they like brain tissue. And we don't know why some people develop neurological symptoms and why some people develop psychiatric symptoms. But in short, the infection is causing damage to the brain. And so that's why we see things like psychiatric symptoms. And then in terms of long-term chronic infections, we're probably seeing that the infection or those cytokines that I was telling you about or any other immune dysregulation is probably changing the circuits in your brain. So the brain is complicated. There's lots of complicated neurobiology that goes on to make people be happy and be in their resting state. And anytime you tweak with that, and an infection in the brain obviously is affecting that, it can change your neurobiology. So that means your brain chemicals that are important to keep us happy and healthy, like dopamine, norepinephrine, serotonin, all of those, they help with keeping your mood stable. They help with focus. All of those can be off when you have an infection.